Hello, welcome to the Urban Polling and Activator online workshop for allied health professionals. My name is Juliette Fritchie and I'm an Urban Polling Master Trainer, and I'll be taking you through this first video of our first module today. I am an Australian Urban Polling Master Trainer and a physiotherapist, and I've been using polls for probably about 15 years now, and found that they were so useful in my practice that I did further study, and in 2015 completed my PhD in pole walking and the health benefits for older adults. Currently, I teach urban polling workshops for health professionals, and I also run groups and walking groups and exercise groups, and I'm also involved in private practice. So you are here because you are interested in urban polling as a form of Nordic walking, and probably also to use it in your clinical practice. So without further ado, let's get started. So who are we? Urban Polling is a Canadian Nordic walking company, and they developed the urban polling poles and the technique of urban polling. And it's a Nordic walking technique, but it uses strapless poles. So the lady on your right-hand side of your screen is Mandy Shintani, and she's an occupational therapist with a master's in gerontology. And in 2005, she developed the Activator poles. She looked around at Nordic walking around the world and the kind of poles they were using, saw the benefits for the kind of population that she was dealing with, and modified the poles to suit the more therapeutic and clinical population. So it's a Canadian-owned and operated company, and it was the first one to bring Nordic walking, also known as urban polling, their particular version, to Canada. They are Canada's largest educators and distributors of poles, and they have a very large educational component to their business. And you will find on our website, Pole Walking Australia, and Urban Polling website, a lot of webinars, free webinars for different clinical conditions. Their poles are used extensively by healthcare, exercise and fitness professionals in Canada and in various other countries around the world. Pole Walking Australia is an Australian distributor of urban poles, and we exclusively deal with urban poles. And I'm an urban polling master trainer and part of Pole Walking Australia. So let's look at the agenda of this course. This is the online version of our live day workshop that we run, and it's the Australian version of the workshop. In this, there will be 3 pieces of the pie, if you will, and the first one is the core sessions. So these core sessions will deal with the urban polling form of Nordic walking, and then that's for conditions that are you're still able to walk fairly normally, and for normal fitness and exercise. We'll also deal in these core sessions with the Activator form of walking, and that's using the more stable Activator pole for clinical conditions. There will be a chance to both look at demonstrations and also practice your pole technique at this stage. The second piece of the pie is primary conditions, and this particular section is very much attuned to where you want your learning to focus. So anywhere upwards from 3 primary conditions, and these might be something that you're interested in, something that or a clinical population that you work with. And that will also include exercises that are useful for this particular population. And thirdly, there will be an individual online tutorial session, a one-on-one session, where you will have a chance to practice, have me have a look at your technique, ask any questions you need to ask about your particular population or anything else that might pertain to using poles in your clinical practice. So by this time, you will have your activator poles. Most of you will have activator poles and conversion boot tips. You may have some urban poles with you as well, and we will talk about the difference between activator and urban poles later on in this session. So the core sessions, which is the first module, will consist of this particular session, which is an introduction to urban poling, also known as Nordic walking, including research. And then there will be an urban poling video of the technique and some of the stretches, and you will have a chance to go away and practice your technique. Then we'll have another video looking at an introduction to activator poles and the difference between urban poles and activator poles. We'll also look at research into activator poles, and then again another video technique and a chance to practice with the activator poles. And then the 2 last sections are smaller sections to do with posture, because posture and stability underlie nearly all other conditions that we're dealing with when we use poles, and then look at shorter sections of other conditions which might not be covered in the primary conditions. So let's start with urban poling and what exactly it is. This photo is a picture of a combination of my exercise and my walking group. Most of them are using an urban poling technique to walk with. Now I'm going to show a video, and this is a video of an urban poling technique in a normal population. You'll see a couple of women walking with the poles, and that will give you a little bit of an idea of what it looks like when someone like you and I, or somebody down the road, goes out for an hour, grabs their pole and uses it as a fitness technique. So this video is two women just doing the normal urban poling technique, which is very similar to a Nordic walking technique. You will notice a few things about that. Firstly, that their poles are quite diagonally facing. They're behind them. They never come up to the front, and they never come in front of their feet. Secondly, you'll notice that their arms are swinging from the shoulders and they're quite straight. So they look like a slightly exaggerated version of walking. And they have a slightly longer stride length than you would if you were just normally walking. It's a slightly faster paced walking to normal walking because of that longer stride length and the push that you are using when you have those diagonal poles. So what is urban poling? Think of cross-country skiing without the skis. Urban poling is a total body workout that can be done anywhere and any time, as long as you have a decent stretch to walk in. The sport's very popular in Europe, and it became popular as an off-season training for cross-country skiers. And that's why often it looks a bit like skiing. It combines specialised walking poles with aerobic and strength training. So these are a few things that happen when you add poles to your walk. Walking is an excellent exercise and an excellent physical activities. Walking without poles will use your trunk to some extent, but mostly your lower limbs. So you'll be using your hip extensors, your thigh muscles, quads and hams, your calf muscles, your gastrocnemius, and also your tibialis anterior to dorsiflex, your feet. If you add poles, there are two things that happen. The first is you get all your upper back muscles start to work because you're pushing backwards with the poles. So you get your rhomboids, your mid-lower trapezius, you get your posterior muscles of the arm moving, your infraspinatus, your triceps, your forearm flexors are working a little bit, and you're also getting your shoulder muscles, so your deltoids, your pec major, and then you've got also your abdominals and your internal obliques. So that uses roughly around 90% of your body's muscles. That in turn will increase your calorie expenditure. So Church was one of the first people to look at what happens when you are using poles, and he found that Nordic walking increased energy expenditure and oxygen consumption by an average of 20% in younger adults, and some subjects increased it as high as 46%. It really depends on your technique and how hard you're pushing on the poles. And lastly, you get a core strengthening effect. So if you're walking about 1,000 steps in 10 minutes, which is what most people do, every time you push down on the ledge, so you can see a photo just above the text there of somebody holding the pole, and if you push down on your thinner eminence, you will get a contraction of your abdominals. So you can do that at your desk. If you're sitting at your desk now, if you put both the sides of your hands on the desk and then push down, you will feel your abdominals contract. If you push one side, you'll feel one side contract. If you push the other side, you'll feel the other side contract. So when you're pushing on that ledge, and especially if you've got a long lever arm, you're getting that abdominal core contraction. So here are the Australian Adult Physical Activity Guidelines. Firstly, doing any physical activity is better than doing none. And so if you're doing physical activity in any continuous stretch of 10 minutes plus, and you were doing nothing, you will start to get health benefits, and not just health benefits now, but health benefits for the future. If you're currently doing no physical activity, start by doing some and gradually build up to the recommended amount. Secondly, be active on most, preferably all days of every week. Different countries have slightly different version of this. Some say 5 out of 7 days. Australian guidelines say most, preferably all days, because we want people to be doing something every day. Thirdly, accumulate 150 to 300 minutes of moderate intensity physical activity. That's moderate intensity for lay people is walk and talk. So you should be able to walk comfortably and talk at the same time. You might have a slightly increased breath rate and you might be a little bit puffed, but you should still be able to carry out a conversation. Or the equivalent of vigorous intensity, which is half the time. So if you do 150 minutes of moderate intensity physical activity, if you convert that to vigorous intensity, so something like running, you only need to do 75 minutes. Or you can do a combination of both each week. So moderate intensity physical activity is 3 to 6 METs, and brisk walking is about 5 to 5.5 METs. And that's what we want people to be doing. 150 minutes is only a half an hour a day for 5 days. So 300 minutes is an hour a day. And lastly, do muscle strengthening activities on at least 2 days of each week. So the World Confederation of Physical Therapy is very pro getting people to do that physical activity, and we're finding now that a lot of conditions that people suffer from can be alleviated if they start to exercise generally. They have put Nordic walking in the strength and balance exercise category. However, it's just as easy, it's just as relevant in the moderate intensity physical activity category. So urban polling as a physical activity is a really good one. And as a physiotherapist, I'm quite familiar, I've always been quite familiar with doing exercises in groups and standing and seated exercises and indoor exercises. Doing outdoor exercises and getting people to do a cardiovascular fitness exercise is a little bit more challenging to find appropriate exercise. And one of the things is that as people get older, they get slower with their walking, or they're not able to walk. Urban polling is something that is accessible to a very wide age group. So one of my walking groups until recently had a 92-year-old and also people in their late 60s. So you can either use the pole as a support, or you can use it to actually work yourself a little bit harder. It's also about ability, not about disability. So if you need some support with walking, a pole has the connotation of being something a bit more sporty. And this young gentleman on the right-hand side of your screen, you will see he was lighting the flame for the Pan Pacific Games a few years ago. He was normally in a wheelchair. You can see the wheelchair behind him. And he used the pole to stand, to walk, and to normalise his activity. So why poles? What is the research behind using poles? There are over 270 studies now on the benefits of Nordic walking, both in clinical conditions and also in non-clinical conditions and in normal people of all age groups. So clinical conditions that have been looked at are arthritis, hip and knee osteoarthritis, diabetes, Parkinson's, stroke, cardiac and mental health, breast cancer rehab, so post-mastectomy, weight management, musculoskeletal injuries. I've put older adults there, but they're not a clinical condition. They're just a population, and they have looked, and we will look at some research in that area as well. So the effects that have been found in various populations include improved balance, a normalised gait pattern, which is very important because a lot of clinical conditions either have an asymmetrical gait, like for instance in stroke, or they have a variable gait pattern like Parkinson's disease. And they do find that using poles does normalise the gait pattern. Upright posture, that's the upper back, the core work, the trunk work that you do with the poles. Falls prevention, reducing impact to lower extremities, core strengthening, and improved psychosocial measures. Psychosocial measures are not exclusive to urban polling. You get them with all exercise, but they're absolutely critical for having people enjoy a good quality of life. So I'm going to go through a few of these conditions now and the research into them. So Parkinson's disease, this is Reuters and colleagues, and they looked at 3 different types of exercise. The first was a flexibility and relaxation program, normal walking without poles, and Nordic walking, and they looked at the effects on Parkinson's disease. So assessment after completion of training showed that pain was reduced in all groups and balance and health-related quality of life were improved. So it doesn't matter what you do get improved physical and quality of life benefits. However, Nordic walking was superior to the flexibility and relaxation program and the walking program in improving postural stability, stride length, gait pattern, and gait variability. So these are all those gait variability type measures. Hip osteoarthritis. They, again, this is Bieler and colleagues, they compared 3 groups again: home-based exercises, strength training, and Nordic walking. So they found that Nordic walking was superior to strength training and home-based exercise for improving function. So generally, improvements in functional performance were greater after Nordic walking compared with the other 2 at all follow-up time points. Furthermore, Nordic walking was superior to home-based exercise for improving vigorous physical activity, which is interesting because they would have checked that on accelerometers. So people were actually bumping up into that vigorous physical activity category when they did Nordic walking. And it was superior to both strength training and home-based exercise for improving mental health. Knee joint forces. So this was an analysis that was done by Wilson, and they looked at 3 different positions of the poles and not using poles at all. And they found that people using poles walked at a quicker speed with reduced vertical ground reaction forces, vertical knee joint reaction forces, and supported movement. And that depended on where they held the pole. And so that comes into its own when we start looking at the activator method, which is a slightly different way of holding the pole, and that has slightly different effects for ground reaction forces. Stroke. This was a treadmill training research project. We do not advise using Nordic poles on treadmills, but this particular research project did that, and they found that gait, balance, and activities of daily living improved more significantly in the Nordic walking group than the plain walking group. Musculoskeletal injuries. So Koser looked at 12 weeks of Nordic walking and found that that improved shoulder mobility while reducing tenderness in the following muscles in female office workers. So trapezius, middle trapezius, infraspinata, and lat dorsi muscles. Hartwigson did a randomized control trial comparing supervised and unsupervised Nordic walking and found that both groups reduced lower back pain, resulting in the reduction of oral pain medications. Breast cancer rehab. This is there's been a couple of quite interesting research projects looking at people post-mastectomy. The first one is Fisher, and that was looking at people post breast cancer, and they found that patients' vitality improved, perceived shoulder symptoms severity and limitation in daily activities decreased, and goniometric data indicated that range of motion, that's forward flexion, abduction and external rotation of the affected shoulder, improved significantly with 10 weeks of training. So they did find that walking with poles is feasible and a potentially valuable tool in the rehabilitation of patients with breast cancer. Johnson and Johansson, this was a pilot study done, and they looked at lymphedema in the arm, and they found a significant reduction in total arm volume of the lymphedema arm, also absolute volume and relative volume. They also found an improvement in decrease in heart rate and subjective ratings of tightness in the arm. Mood and depression. Sweeter and colleagues looked at depressed patients in clinical practice, so GPs going through GP practices, and they did a lot. So they did 24 weeks, almost half a year, but they found that it increased the patient's physical activity and their mood. And Staunton was probably, I think, the earliest research project that looked into the effects of walking with poles. They compared walking with strapless poles, normal walking, and controls. And they had 12 weeks of 4 sessions a week. And she found improved mood, less fatigue, decreased depression and anger compared to walking. Older adults. This is comparing Nordic walking and general exercise of 3 weekly sessions, so 3 sessions a week for 12 weeks. And this is in frail people over the age of 70. So there were 20 individuals, and they were divided into a Nordic walking group or a general exercise group. And they looked at balance, upper extremity strength, lower extremity strength, general weakness, and depression. And they found that, with the exception of upper extremity strength, all the other measures demonstrated a statistically significant improvement. However, in the general exercise group, only balance demonstrated a statistically significant improvement. So what we find with this research, it seems to fall into two general sort of things. One is that you get more improvements in more measures compared with walking. And the second one is that you tend to get an increase, like it's like walking on steroids. So you get a better improvement when you use poles with walking. So let's look now at who is suitable for using urban poling. Now, don't forget, this is this is for fitness. This is for fitness and physical activity. So people in early stages of neurological conditions who are not using a lot of support, who don't have a lot of balance issues, great to get increased physical activity for them. Younger or active clients, and by younger, often I mean younger old adults, so people sort of from age 65, which is where old age starts in most research that is done, but also so from the age of maybe 55 until sort of mid old age, you can really push those kind of, and even older in some people, that kind of fitness activity. People who are undergoing rehab from lower limb injuries or surgery, it might be a nice transition from walking into more vigorous sport or activities. Obesity and weight management, cardio rehab, diabetes, and core strengthening. I have seen some really nice results with people who have weight issues. Don't forget that if you have a weight issue, in order to maintain weight, you need to do, the research shows, about 1 hour per day of physical activity. So it's not saying if you do it once or twice, you're going to improve your weight. You will have to work at it, but it's a really nice option for people who have weight issues. Employee wellness and progress from an activator technique. So I've had this in a couple of my clients who have started off, their balance isn't wonderful or their fitness isn't wonderful, and they've started off with a more stable technique with activators, and then they've improved, and so they've moved to urban polling technique. So this is the difference in strapless method of Nordic walking to normal Nordic walking. And this is the urban polling strapless grip. You will notice at the bottom of the grip, there is a shelf, and that is what you rest your hand on. That means that you don't have to grip hard, because if you push down, that holds your hand on the pole. It's not the grip that does that. So you have left and right hand grips and handles and poles, and that supports the wrist in quite a nice neutral position. It's a lovely ergonomic grip with a slightly wider and larger grip than most hiking and Nordic walking poles. Really good for strengthening, for those abdominal muscles and for balance. Don't forget to check that your clients have a loose grip and it's just resting on the ledge. So I'm going to go into the urban poles design. Now you have, probably most of you will have a activator pole. These are urban poles and they're slightly different, but you can interchange activator and urban poles for most purposes. So let me have a look here. Urban poles are telescoping, as are activator poles, but they're using a twist mechanism. So if I can show you my pole, it's a twisting mechanism to lengthen and to shorten the pole. And then I twist again and it tightens it up. This enables people to go around about 188 centimetres is the tallest that could go with urban poles. They have 3 different vibration reduction mechanisms in them. The first is this, and this is the ferrule. It's got nothing to do with the twist mechanism. It's merely a vibration reduction mechanism. The second is the core grip ledge. So there's the ledge, and that has a little bit of give in it. So every time you push down, you get a little bit of cushioning there. And the third, I'll show you my nice new boot, because the other one's a little bit flattened, is the boot tip. Now these boot tips are the best I've seen on poles. They have a really nice rubber tip that gives quite a bit of vibration reduction when you're walking with them. They have a turning lock, as I mentioned, and that allows up to 40 kilograms of weight to go on a pole. We recommend that people are 120 kilos is probably the limit to have somebody walking on a pole, because you're never going to put your whole weight on a pole, and 40 kilograms is quite a lot. So I'm going to make this a bit smaller here, and I'll just show you the different types of poles, because you probably don't have them with you, but if you do, you might know about these poles. We have Series 300 poles, which are the pink ones, and a proportion of the profits of those go to cancer wellness programs. We have Series 300, and then we have the 3-section Adventure Series pole. So this is the 3-section one, and it's quite a lot smaller, and that's what we use for hiking and for traveling. It just means it goes down and probably about 10 to 15 centimeters shorter than the normal poles. So these are the twist mechanism poles, and they will come with the boot tips, which you can see there. Let's look at the urban poling technique, and what I'd like you to do is to get out your activator poles now. So you will see your activator pole, and it will have a very different boot tip from what we were looking at. And it will also have a different mechanism for extending. So what I'd like you to do is to pull off your boot tip there, and then that's a bell-shaped boot tip. This is a boot-shaped tip here. So if you take your boot tip, and then you can put it on the bottom of the activator pole, and voila, it turns into an urban pole, which is very economical if you have people who you think are going to change in their technique. So you will have a different mechanism for extending, and I'll just show you that now. So if you twist your pole, you will find as you twist it, you'll come to a stripe, and that stripe, if it's a freely twisting, so you've made it so it moves, and then you twist it, and you will eventually find a white stripe, and that just lines up the button with the holes, and then you can pull it out and the button will go into the hole. So these have a slightly different mechanism for measuring up, and the best way for you to measure it up is to, when you're standing and the poles are held vertically and your arm is vertically at your side, your elbow should be a little lower than 90 degrees. So adjusting the pole length, if you have this kind of pole, is that you untwist, you pull out, and then you will see on the pole different heights, and you just pull it up to whatever height you are at and twist it and lock it up. So with most people when they're starting, in fact, with all people who I start with urban poles, I will put them down a couple of notches shorter, because it's easier to learn to walk with a shorter pole. So if you have your activator pole, just make sure your elbows are a little under 90 degrees when your pole is vertical. And if you want to, you can increase the length as your technique improves. So we're going to look now at the urban poling technique. I'll just make myself a little bigger in case I need to demo. So the first thing I get people to do is to realize that it's not a bent elbow technique, it's a straight elbow or roughly straight elbow technique. So if you hold your poles parallel to the ground, and then swing them, don't walk, just swing them, you will feel that's the natural swing of an arm when you're walking, and that's kind of where you should feel it when you are walking with the poles. So then the next step is to drag the poles. So if you look at me in that photograph there, I have my arms by my side. So they're nowhere near the front of me. They're just hanging by my side, and I've dropped the poles behind me. You will notice the boot tips are actually facing the opposite way to my shoes. So that is the other thing you need to make sure, that the boots are facing backwards. And that's because you're on a diagonal slope. So I get people just to walk, so about 10 meters or so, find a 10-meter spot and just walk and drag the poles. Don't worry about anything except for that, hands by your side and dragging the poles by your side. What usually happens if you relax and drag the poles is you start to feel a bit of a natural swing that your shoulders do. So don't try and bring the poles anywhere. Just feel that natural swing. And the first thing that I do often when I'm teaching therapists and exercise professionals is I ask them to switch their brains off, because the minute you start to concentrate and try and analyze the technique, you get messed up. So the whole purpose is to get nice and relaxed, feel that swing, and if you'll notice, my right foot is forward, my left arm is forward. So that is the swing that you'll end up feeling, left to right to left to right. That particular section of learning to walk can take quite a while. So it might take 2 or 3 sessions of getting people just to drag their poles. Don't try picking them up. We're not doing any picking up at this stage. Just dragging their poles and just getting that left, right, left, right. Then we go to what is called the urban poling handshake. So if you're at your desk now, lift up your hand as if you're going to give people a handshake. So we're just going up and we're going to shake someone's hand, and you will notice that your arm stays relatively straight. So I've got my arm up and it's relatively straight. It does have a little bit of a bend in the elbow, but you can see it's not anywhere near 90 degrees. It's pretty straight. It's straighter than it is bent. And so that is when we get people just to swing up a little bit further, and you will feel then as you push down, as you bring your arm down, that your boot tips will connect with the surface that you're on, and you'll feel a bit of pressure. So the last step, which will look very like this one, is that you just pick your poles up. So you don't do any picking up and plonking down until you have that whole left, right, opposite, opposite, opposite. And that again might take 2 to 3 sessions before you have that really nice opposite to opposite hand to opposite leg. So just to reiterate that, and you might want to stop the video here and just go through those 4 or 5 sections of learning to walk. The technique is just standing. I usually get people to stand and swing their arms with the poles parallel. Then put your arms by your side, let the poles drag behind you, and just walk and drag the poles. Then You'll probably notice you're starting to swing your arms. Make sure you're getting outside, left to right to left to right. And then you're swinging up your arm into that higher handshake position, lengthening your stride. And then you can press on the outer edge of the base of the handle. And then the very last step is to lift the poles slightly. And you don't have to lift them a long way. So it's not a plonk down, a lift up and plonk down. It's just a pull up, and it'll only be like a couple of centimeters off the ground as you walk. It does take a little while, and I'm often amused at people who go and do the Camino or go hiking and will buy poles a week before they go, because it really does take a little bit just to get into that natural swing of walking. So it's well worth every day for a few minutes just going up, down the driveway or something and getting your technique going. So this is, those photographs were still, so they were frozen. I was frozen to show you those photos, but this woman is actually walking and you will see what happens. She gets quite a long stride. Most people will not get that long a stride. You need to just go to where your hips are comfortably working. She's got that handshake position, so a long arm, not a bent arm. She's got a very relaxed grip on her handle, and then her arm only goes back down to her hip. It's not going behind her at all. Her chest is up and she's walking in a nice relaxed manner. So here are some common errors. They nearly all boil down to the bent elbow thing. So the first one is not keeping your arms extended and bending your elbows. And I say to people, this is not a hard and fast technique. And a lot of my people who've been walking for a long time have gone into a bit of a bent elbow technique. The important thing that I think is that they are doing some physical activity, they are getting some benefits, and I don't want to keep harping on about, you know, doing a proper technique, because they're enjoying their life, and that's important. So when you're teaching someone, though, it's good to teach them to do it in a really proper way, and that will give you the most core benefits, the most core control work. So don't bend your elbows, swing from your shoulders. I often say to people, don't lift the pole, because you don't have to lift it very far. Just pull it up a little bit. The pole's vertical is because people have bent their elbows and they've brought them up. So if a pole is vertical, it's usually, you will see that people's elbows are bent. So again, pull the pole, don't lift it. When people are learning, it's a good thing if they're just getting confused and frustrated, just go back to dragging the poles. And I might do that a couple of times. Okay, we'll stop this. We'll just put the poles by your side. Just drag the poles. Just get used to dragging the poles and swinging from the shoulders. Same arm and leg. That's usually the therapist's issue, because they're thinking too hard. So go back to dragging the poles. Don't try too hard. Don't analyze too hard. Sometimes to do some sort of rhythm. So some people I know who teach have music, and they'll do it to music. I will sometimes walk past somebody and walk with side by side with someone, and I will say, okay, I'm going to say one, or I'm going to say left. And when I say left, your left pole should hit the ground. So then I'm going left, 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 left. And the right arm tends to come naturally, or the other arm tends to come naturally when you do that. I usually pick the side that's the least, that's the most, that they're having the most difficulty with. So concentrating on one side only also sometimes helps. So I might take one of the poles away from them, and I'll say, okay, just work with the one pole, and now we'll give you two, but just think of that one pole and do it that way. Again, don't overthink, just relax, go back to dragging the poles if you're having struggles. Arm swing too slow is usually because your walk is too fast. And sometimes when people are really trying hard, they go, right, I have to walk really, really fast, and go boom, 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 boom. Because you're having to swing your arm through a greater arc than usual, you then have to pull your arm up really fast. So, so slow down, take longer steps, and then the counting sometimes works with that as well. So you're getting that swing. But just remember that it is usually because they have to swing their arm up faster than a normal walk. So that's what happens. And dragging the poles, I don't consider this too much of an issue, because it does help them get that arm swing, that natural gait, and a little bit of rotation in their trunks. So dragging the poles might occur for 2 to 3 sessions, and they might not get that lift. If they're still dragging their poles and they haven't quite got that pick it up, I will say just pull, and instead of listen, just listen to what's happening, and you'll hear a drag, drag, drag. I want you to change that to a tap, 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 tap. And usually it does come naturally as they get their rhythm. Trails, gravels, and sand. A lot of people will use poles for hiking rather than walking, and there's nearly always somebody in my courses who wants to use the poles for hiking. So a couple of tips: we hike with our poles all the time. I would never not use poles now. They come to their own when you're going up hills and down hills. There's stability going down hills, and they really assist to go up hills when you have poles. You can, if you've got, I find the only time I generally remove my boot tips is if I'm in very soft sand and they're going to sink. And I've walked on a lot of sand, and it very rarely do I get to that kind of really sinky sand. But if you do, then you can use the sand baskets. I will use them more if I'm on kind of slippery ground. I'll take the boot tips off if I'm on kind of gravelly, or it's a bit muddy, or it's kind of a bit slippery. Then I'll take the boot tips off, because when you take them off, you get this carbon fiber tip, and that will give you a little bit more of a grip in muddy or soft sort of soil. If you're on rocky ground, so that's my husband there, and he's going down some cliffs. And if you're on rocky ground, you're much better off to have the boot tips, because they won't slip on rocks. This third point, keep the poles more upright. So this is the one time when I do bend my elbows, and the reason is if you're walking with a classical urban poling or Nordic walking technique, and you're traveling at single file, you are likely to, or there's more of a danger of tripping up the person behind you. So I keep the poles a little bit, they're still angled backwards, but they're a little bit more vertical than if I was walking along a just doing my normal walk. And I still swing from my shoulder, but my elbows are a little bent. And if I'm on a path when I'm walking, if I'm walking for 5-6 hours and I'm on a very easy path, I won't use my poles. I'll just carry them or very lightly touch them to the ground, because I don't want to be using up that 20% more energy, because the reason that I have poles is to help me not to overly exhaust me when I'm walking. Using the palm, so the left-hand side is the standard hold, which most people will use for most things. I have used a vertical hand position when I'm going down hills, when I'm hiking and going down hills, because it will appreciably lengthen your poles a little bit, so you don't have to keep, lifting them up and down. And so when I'm going uphill, I'll use them in the standard grip. If I'm going downhill, I'll pop my hands sometimes on top of the pole, and that just makes it a little higher for me. You can also use it as a horizontal grip as well. Don't forget that the boots should always be facing backwards, so you may have to change the position of your boot tips if you're twisting your pole at all. And if you find you're walking and it feels a bit weird, just check that your boot tips are actually facing the right way. So I'm going to leave you now, and you can watch whatever you need to. If you want to go back to the practical photos, then do that. There is a practical video which you will also have, and you can have a look at a video of someone walking. But this is the time for you to just get out, use your poles, give it a bit of a go, have a little practice. Don't forget, drag the poles first and then get that natural swing happening until you can get that left, right, left, right. It will take a little while, but some people get it immediately and some people take a little bit longer. So I'll leave you to it, and I will catch up with you at the next